Thank you, John. October is Breast Cancer Awareness Month, and today we're going to focus on the importance of early screenings and self-exams.
Doctors say those self-breast exams can be a bit challenging, but they can save lives. So you want to check for any changes in the shape, the size, or the texture, which can be difficult because breast tissue can normally feel lumpy and bumpy. So you want to look for any new tenderness or any new lumps in the breast or underarm area that seem out of the ordinary for you or different from the tissue around it.
And make sure you perform a breast self-exam every month, not just October. Also, make sure you're getting regular mammogram screenings, especially if you're 40 or older. Doctors say most of the time these symptoms do not mean you have cancer.
A lot of these areas, women can be ultimately reassured that they're just normal breast tissue, which is lumpy, bumpy, and very challenging on self-exam. So it is important to explain to your doctor any new concerns that you have. Your doctor may send you for additional testing, such as a mammogram or possibly an ultrasound, just to help, but it is really important to work up those areas.
Early detection of breast cancer is key to less invasive treatment and survival. And right now, doctors and researchers here in Northeast Ohio are making advancements and also improving outcomes and quality of life.
Yeah, let's get our Meg Shaw shows us how doctors are looking at the long-term side effects from chemo for breast cancer patients and how they can better serve them.
Right now, 2 Cleveland Clinic doctors are involved in a clinical study along with colleagues at the University of Utah, looking to better understand chemotherapy-induced nerve pain called neurotoxicity paresthesia.
And this can, in some patients, be long-lasting and very troublesome.
It is a serious and often long-term side effect of certain chemotherapy drugs to treat breast, ovarian, or other cancers. Now, some patients experience it and others don't, with no real explanation as to why.
Our goal is to actually look at combinations of different molecules that can be used to better and more accurately predict who's likely to develop these symptoms.
The study involves taking blood samples, looking at genetics, and recording symptoms of patients as they undergo chemotherapy treatments.
These drugs we have are very important, but they have side effects. And this is well known to patients, and it's very important that we try to reduce these side effects by understanding who's likely to get them so that we can determine who might best be used with which drug.
Dr. Daniel Rotroff is one of the 3 lead investigators of the study. He says right now, 40 breast cancer patients are enrolled.
We found that patients are very enthusiastic about participating. I think that's one thing about cancer patients in general that I've noticed here is I'm always amazed and humbled by their willingness to participate.
So far, patients have been encouraging. They are interested in doing what they can to help us and to help other patients to learn more about this.
They're hoping to get 400 by the time the study is done in 2 to 3 years, leading to more tailored, targeted treatment options for patients.
Although we've made huge strides, especially in treating some subtypes of breast cancer, there's still so much work to do.
For News 5, I'm Meg Shaw.